an accident where you could be bleeding internally, that the urgent care said you should go to the emergency room. But he didn't stop the appointment. He didn't say, "Oh, you should go to the doctor." He didn't show any concern, but yet you're saying he showed warmth. I'm confused.
So that was January
I'm
2023.
very confused by
And
this.
I also told my therapist about this. She said nothing. I got it.
All right, so the therapist and the psychiatrist are both
After I risked my
a
life
mess.
to see him, that's when he really started turning up the intimacy in our.
What the hell is on her face? What, man, I feel, it's been a while since I've been in therapy, but after listening to this girl for however long this has been, I feel like I need it.
Appointments.
Like,
however,
now.
he was really smart and knew the professional lines like the back of his hand. So he would comment on my appearance, but not compliment my appearance.
Well, because complimenting you would be unethical. Like, right? Right or wrong. So, all right, elaborate, Kendra.
So I would come on screen and he would say, "Oh, you curled your hair." Or I would come on screen and he would say, "Oh, you're wearing glasses." And of course I felt,
well, maybe because he hadn't seen you in glasses before. Oh, you're wearing, I didn't know that you needed glasses. Or you curled your hair and you thought maybe he was just mentioning because he could tell, see that your hair is curled when it's normally not. Maybe he's recognizing that you're trying to look a certain way for him, or maybe it's just a way to start a conversation.
seen and excited that he was noticing these things about me. I didn't realize at this time.
And I do feel like any therapist or psychiatrist I've seen, I've had good and bad experiences, I think I mentioned, but I mean, I'm not hearing anything that's making me go, "Oh my God, this psychiatrist, what a pig." So, all right, tell me more,
That
Kendra.
he had feelings for me too. I thought I was holding them all by myself.
Wait,
so
you're saying because he noticed that you had glasses on and that you curled your hair, that he had feelings for you? Okay.
I was so excited when he noticed my glasses that I ran and showed him my other pair, and he said, "I prefer turtle shell glasses." So even though I usually wear contacts, I'm wearing these turtle shell glasses in these videos because just in case he sees them ever.
What the hell? What?
He'll see me in his favorite glasses. He did tell me he likes the turtle shell.
Oh my God, Kendra.
Anyway, it was just inappropriate things like that. Little teeny.
Why is it I don't necessarily think it's inappropriate to be like, "Oh yeah, I like the turtle." Why is that inappropriate? It'd be inappropriate if he said something like, "When you wear glasses, you look really sexy." Or with your hair curled like that, it's really, you look very attractive. You didn't, am I missing something? Is it me?
Things that he let
Maybe
me
it's
in.
me.
And all this time, my best friend is an emergency medicine physician. And she told me, she said, "Kendra, one of these days, your psychiatrist," she would use his name, "is going to say, 'I can't be your doctor anymore. I want to be with you.'"
Okay. If I was your friend and you were telling me, the stuff that we've been watching so far, I would literally tell you, you should not be seeing that person because what the hell's wrong with you? And just because they said they like turtle shell glasses doesn't mean they want to bang you, but okay.
"I want to be with you so bad. I can't be your doctor. I'll see you in 2 years." So
that's great. So your friend also needs therapy, is what you're telling me. Okay, good.
Best friend, who's a doctor, she picks up on stuff like that.
Yeah, because obviously the therapist that you're talking about and the psychiatrist who is a doctor, who you're basically talking about how unprofessional they are, but your friend is a doctor and she sounds like a genius. Yeah, all right.
So even she knew that our
Kendra, he's in love with you, Kendra.
relationship was crossing boundaries.
He said he noticed you curled your hair and that you're wearing glasses, and then told you he liked tortoiseshell glasses, and now you're saying you wear. When she just told that story, the way she told it, to me, she wasn't wearing tortoiseshell glasses. She was wearing glasses, and then he said, "Oh, you wear glasses," and then she's like, "Oh, and look at my other pair," like a little girl, and then he said, "Yeah, I like tortoiseshell, that style." And then you seem to run out and get a pair of tortoise shell glasses that now you're wearing in this video because you're assuming that he's going to watch this and I guess rub his balls. I don't know. All right.
Boundaries and
His own
getting
professional
weird.
nuts.
But that was like, that became my dream, was for my psychiatrist, I almost use his name, to do that. And I told him about Brianna saying that, my best friend, who's the emergency medical doc. I told him that she would tell me that, and he just would be silent.
I wonder if he was silent. Now, again, I wish you would tell us, did you express to this person? And if I missed it, someone tell me in the comments. Call me out for the dingbat I am. Did she ever say to him specifically, I'm attracted to you? Like, I'm falling in love with you, or like, whatever. Because I missed that. I don't remember her saying that. But she's telling her therapist and her friend the doctor, and her friend the doctor, the genius, is just feeding this delusion more so. He's in love with you, Kendra. I swear he's going to tell you. He can't see you anymore because he's in love with you. And so then I tell my psychiatrist that my friend, the doctor, who's a genius, is saying that. If I was a psychiatrist, I would say, well, why would she say that? What was the conversation that led up to that? I don't know if what she's saying right now is actually true. If she actually said this to the psychiatrist, that my friend is saying that you're in love with me, and you're gonna all right.
He didn't disagree, but he didn't agree, and that was weaponized neutrality was his favorite game to play, right? He didn't disagree with Brianna telling me that my psychiatrist had feelings for me, but he also didn't say that's inappropriate. Let's change.
I wish I had. You guys ever see that dating show on Netflix? It's called is it I Detect? Love is fuck. It's there's 3 seasons in Poland, 1 season in South Africa, 1 season in Spain. And they basically do an eye detect to see if you're lying or not. I wish I could do this on Kendra right now.
The subject. It was also around this time that I asked my psychiatrist if he had diagnosed me with anything other than ADHD when I had my initial diagnosis. And he said, yeah, I did. I said, oh, what did you diagnose me with? And he said, well, you had a lot of traumatic things happen to you in childhood because of your dad. And so I diagnosed you with other trauma and stressor related disorder. And that was the first little ping that I got of like, that was weird. Why would he keep that from me? I asked why wouldn't he tell me that? That seems important. He didn't tell me because he was using that information to manipulate me.
I can only speak from my own experience, and I feel like I've been diagnosed with certain things and they didn't openly discuss it with me, which I also felt like that's one thing I'll agree with Kendra on. Like, why not tell me what you're what you're writing down about me when it comes specifically to things like if you're gonna categorize me or diagnose me with something. And that's interesting if it's true.
He knew I had trauma and stressor disorder.
Well, if you had trauma, though, and stress disorder, maybe even bringing that up or deciding, as I'm, again, playing devil's advocate, the psychiatrist may have been feeling like you're like in session with them, still seeing them. Maybe they're still trying to determine the best way to treat, you as an individual, or they're not sure. if that diagnosis is correct.
And instead of helping me heal from it and telling me about it, he used it against me.
Now, I don't know how they treat the things she just mentioned. Part of that treatment might be things he was doing. So I'm not sure about that. If you have experience with that and you feel like sharing in the comments, specifically those diagnoses, let me know.
After I risked my life to see him, that's when he really started turning up.
All right, here we go.
January 2023, at this point, I was full-blown obsessed with
I don't know about you guys, but the glittery purple freckle thing going on, it's like, what is this? What is that?
My psychiatrist, and my therapist wasn't helping me. My psychiatrist wasn't helping me. He was feeding it.
I would say it's like what she just said. My psychiatrist and my therapist were not helping me. I have felt in the past when I was in treatment that I wasn't being helped. And like left therapy and then went back like a year later and ended up seeing the same therapist. And I realized after I had time to like step back and look at the situation, my therapist they were helping me. Like I felt exactly like this person just said, Kendra here. Like I was in therapy, I was doing the blah, blah, and they weren't helping me. It wasn't helping me. But after I stepped back and kind of looked at it from a different perspective, I realized my therapist was doing the best they could with what they had, what they could do for me. A lot of it was that I wasn't in the right state of mind. So like if you're not in the right state of mind, and usually if you're in therapy, seeing a psychiatrist, all of that, usually there's a reason why you're going through things. Not everyone is like dealing with a chemical imbalance or a specific diagnosis. Sometimes you're in therapy because you just need someone to talk to and vent and get it, you want to get feedback, things like that. But their job, in my experience, is that they sit and they listen. They're not supposed to tell you necessarily, go do this, go do that. You have free will. They're supposed to help guide you, depending on your diagnosis, and actually, I could swear in the video or two before, you said that the therapist was helpful. Like, they were giving you specific things to do. So, I don't know. I would love to hear from that therapist also. Like, did you do the things that the therapist was suggesting and it just didn't work? It's sounding like you have certain issues that either weren't recognized, were misdiagnosed, or you were properly diagnosed, but because you're in it when you're in treatment, you're like in it. Meaning, you know what I'm saying? That you can't see from outside of yourself. All right? You get what I'm saying?
And then I got a boyfriend. And at first, my psychiatrist wasn't really that keen. But then my psychiatrist realized that
they may have not been keen because if you're in therapy, psychiatry, and also you're in recovery, which this person said they were clean for X amount of months, you're not supposed to be in a relationship with anyone other than yourself. You're supposed to be single. Others who have dealt with that type of sobriety, you know what I'm talking about, right? All right, let's continue, Kendra.
Boyfriend was a lot like my psychiatrist. And then I started talking to my...
How would you... All right, first of all, I kind of am bothered by the fact that you feel like you know your psychiatrist so well when this is someone that you would see once a month on a Zoom session. They're your psychiatrist. You know them as your psychiatrist. I don't care if they shared with you that, they succeeded in certain things or blah, blah, or they share some things about themselves. You don't know them. It's just freaking, again, you're paying this person. All right, anyway, continue, Kendra.
Psychiatrist about my sex life, about tracking my cycle, using the fertility awareness method.
Yeah, he probably became concerned that all right, don't reproduce.
And my psychiatrist loved it. He didn't never say, this isn't inappropriate to your care.
Did he literally say, I love when you talk about this stuff with me, Kendra? She's saying he loved it. He never said it wasn't appropriate. I don't understand the way. Maybe it's just me.
Let's pivot. Oh, he just let me.
You're paying him to sit there and listen. So he's going to let you talk about whatever you want to talk about. Usually that's how that works. And he's probably doing that because he's seeing where your priorities are at. Like, you've been in therapy or seeing him for X amount of months. So he's seeing, like, you talk about you had daddy issues, obviously recovery, other things going on, trauma, whatever, childhood stuff. I'm going to say that he probably was aware that she was attracted to him in some sort of way because he's probably not a total idiot. And you can tell by someone's body language and in the way they speak to you and things like that. So he maybe should have cut this person off right away, for sure. But I don't think it's for the reason that she feels.
Talk about my sex life. And
I've talked about my life with every therapist I was ever, male or female, because that's part of my personal experience at that time, and also can give the therapist or psychiatrist a lot of insight as to how your childhood or your daddy issues are affecting your current relationships. I don't know, maybe
too deep, but about a year and a half in, and
it's almost sounding like to me like you were sharing very personal things about your life with this person, and you're not, from what you just said, he wasn't fishing for that information, but he wasn't stopping you from sharing that information, which makes you feel like it's because he enjoyed hearing it. He may have, but the way you're presenting it.
I would send my psychiatrist these emails just about how much I liked him and how I was so grateful for him, and
the psychiatrist
put in a bunch of heart emojis.
But your psychiatrist.
And this is really when he should have transferred my care. But
I will say, if what she's saying is totally transparent, again, just playing devil's advocate, the psychiatrist could have recognized that this person had certain feelings for them, but didn't cut them off as a patient because he may have felt like, see, now if it was me and I was the psychiatrist, the male, and I recognized all this, I would maybe say, maybe you should see a female, because it is inappropriate. But again, most people do have certain types of feelings towards their therapist or psychiatrist. I'm not saying in love, but good feelings, hopefully good feelings about them. And that's why you want to see them and share with them. Maybe it's just me. Again, I'm not saying you should be in love with them. That's not appropriate. Definitely, no. But that's not a rarity. This happens a lot where people develop feelings for their doctors, psychiatrists, and therapists. All right. Especially if they've been neglected and things like that. Now you have a person that you feel is caring or listening. Just listening to someone sometimes will make them to have certain feelings for you. Just because sometimes we fall in love with someone not because of the way they look or who they are, but how they make us feel about ourselves, right?
He waited. He liked what I gave him too much. And so even though my boyfriend did not meet my needs, my psychiatrist and my therapist both were like, you have to stay with him.
I don't believe that. I don't believe that. I don't believe a psychiatrist or therapist would ever say to you, you have to stay with this person. Did they meet this person? Were you in couples therapy? Like, what she's saying right now, I don't mean this. I feel like you're not being honest, Kendra.
There's nothing wrong with him not meeting your needs. I'm like, okay. And my psychiatrist...
What needs are you talking about that you were sharing, like, physically, like this person wasn't fulfilling you physically. I feel like there's a lot of holes in this story here. I don't fully trust Kendra's reenactment of these events.
Was like, he's perfect, don't get wrong with him. And what was perfect about him was he wasn't meeting my needs. So I was still coming to my psychiatrist looking for emotional validation, which he would drip to me.
Oh, all right. Is she saying that they were like, you have to stay with him because then you'll stay screwed up and needy, and we want that money, honey. Don't cancel those appointments just yet.
Slowly. So my therapist, who I didn't know at this time.
Now, if she is being super honest and transparent, then this is really fucked up. But personally, I'm not buying what you're selling, Kendra. That's just me.
Had bad boundaries, but she did. I went to her because my boyfriend and I, after like more than a year together, we started.
Wait, didn't she say she stopped seeing that therapist? Am I nuts?
Having issues in the bedroom. And so I went to my therapist and she asked me, what does your psychiatrist think about this? And I said, I don't know. I haven't talked to my psychiatrist.
That's strange to me because, again, really, if you're seeing a psychiatrist and a therapist, usually notes or something, there's some sort of like doesn't have to be necessarily like a relationship between the therapist and psychiatrist, but usually they're comparing notes or something having to do with the patient that you share. Usually.
About this stuff.
So I don't know why they would ask you what your psychiatrist says.
Because I have a crush on my psychiatrist and I don't want to tell him this intimate of stuff. And she said, well, you should tell him because I want a male's perspective.
I don't know if I'm all right. You guys let me know if you're buying this.
So at my next appointment with my psychiatrist, I told him, I said, today we're going to talk about my intimate life. And he said, oh. I said, yes. My psychologist, my therapist, asked what your opinion on it was. And I told her that I don't talk to you about this intimate stuff because I have a crush on you.
I feel like she just said, though, that she was sharing very specific things with the therapist and the psychiatrist, and they both said, no, you have to stay with this person. Am I mishearing what she said?
And he looked down and smiled so big in that moment. He smiled so big, and I loved it. It's so gross thinking about it. And then I proceeded to give him 30 minutes of non-stop content about my intimate life.
Was it like if I was calling one of those 900 numbers? My
boyfriend. And I actually recorded the whole thing because I was so excited about it.
All right, that's weird. I don't know what state you live in, but in a lot of states, it's not legal to record people without their knowledge. And I don't know if, in general, it's normal to record your session, especially without permission.
But now it makes me sick. I can't even listen to the recording. I've tried.
I would love for you to play it because I want to hear this person's voice. I want to hear if they're speaking to you in the way that you are describing in these videos.
To start, but it's gross. Any ethical psychiatrist...
The way she just said it, I feel like she listened to it over and over and over again.
Would have stopped me and said, Kendra,
while
let's talk about your meds. Let's talk
glasses.
About your care. At this point, my meds were stable.
If your meds were stable, they weren't helping with your overall stability because you do not sound stable now. And I'm not trying to be rude. You don't. You don't sound stable now telling this story. And you obviously weren't stable at the time that you were in therapy. You weren't stable when you decided you wanted to go back into seeing a psychiatrist to begin with.
And I was still seeing him every month. Yeah, that was a rough time. And it was pretty
I
much
feel like I need therapy after listening to you.
Christmas morning, the almost 2.5 years of grooming me to get me to talk.
So now this has been 2.5 years. Did I miss the part where she said so it's been 2.5 years now.
Talk about sexual things with him worked, and he got 30 minutes of nonstop content to use.
So she's saying that this was like his mastermind plan was to see you for 2.5 years so that you would feel comfortable enough to share the smegual things going on between you and your person. But you said in the other video, when you started seeing this new person, all right, again, I'm very confused.
I need to address 3 things. 1, people are asking me what my mental health diagnosis is. I do not have BPD. I do not have psychosis. I have ADHD. And
Honey, you were misdiagnosed.
I was experiencing extreme limerence with my psychiatrist. Limerence is a normal...
All right, so I guess at this point, people... so I see the comments are now off. Like, all these videos, they're off. So when she first put these videos up, people must have been saying, honey, you don't have ADHD, whatever. Now there are a bunch of psychiatrists diagnosing you, as well as, like I'm doing as well. Personally, just listening to you, I don't feel like you have ADHD or ADD. That's just my personal opinion. I'm not going to sit here and act like I'm qualified to diagnose you or anyone else, but just listening to you, it does seem like you might have some sort of narcissism or possible borderline personality thing. Like, just my opinion. Just from, like, listening to you talk.
thing to happen to anyone.
And now now I was in love with my psychiatrist and he kept me away. He kept me anyway, part 7.5, because she was like, oh no, I have to address these people and turn off all the comments.
Was experiencing hot and cold behavior from someone.
No, but that's your perception of what you felt. Like, this is why it's important to always remember there's her side, his side, and the truth. You guys know that saying? I feel like that's what's going on here.
And it happens more often in people with ADHD because we have dopamine dysregulation and rejection sensitive dysphoria. And guess what? My psychiatrist knew that and used it to his advantage.
He might have. I don't know him. I haven't been able to hear his side of things. She could be right. But when I'm seeing this, what I've seen so far, I feel like I'm watching a person who I don't want to be rude, but it almost sounds like was delusional about the relationship with this person. Maybe is not able to read body language very well. That, anything this person did, you felt like it was either manipulating you or getting turned on or something.
2, I accidentally said my psychiatrist's first name in one of my videos. If you clocked it, good for you. I do not owe him anonymity. However, this is not about doxing my psychiatrist.
It almost sounds like you were in love with him and you still are. Yeah.
This is about me sharing my story so other people...
Yeah, but your story has a lot of holes and it's your side or version of a story.
Can view predatory behavior in people in power, okay? If anyone doxes my psychiatrist with his last name or city that he works in or
How would anyone be able to do that if you're saying you accidentally said his first name? It's seeming like she was trying to get this person doxed. Like, she's unhappy with whatever outcome. I don't know how this ended. I guess we'll find out if we ever get to the end of this, but it's seeming like she did this for attention, clicks, to become viral, which it's worked. One of the reasons I came up and decided to watch this is because I saw in my feed, like, all these different reaction channels talking about, I was in love with my psychiatrist and saw him for 4 years, da da da. And I was like, I was ignoring it, and then, but it kept popping up to where I said, all right, let me go check this out. Like, all right. Anyway, it's not Kendra.
That he works in.
Kendra, it seems like you don't take responsibility or accountability for your adult decisions and actions. But just me.
Your comment will be immediately deleted and you will be blocked. This is about protecting other victims.
Oh man, she's reminding me of a few of the girls in Girl World.
Not doxing my psychiatrist. If you do some...
Like, she comes off, the way she said that he was very smug, but like the whole time, especially in this video, she's coming off very smug. But just my opinion.
Investigative work and you want to DM me about it.
As a matter of fact, when we get to the end of this, I'm curious if she reported this person. Maybe I should share my experience that I had with a psychiatrist where they were very inappropriate with me. And I let a therapist know in the, place I was seeing. And that person was immediately reported, not even by me, but by other workers in, like, the therapist that I was seeing, like, that I shared, whatever. Because I didn't even see it necessarily as the person was being inappropriate, necessarily, because I was not in the right state of my own mind. And I was heavily medicated. Like, I didn't even really understand what was happening, if that, because my head was so messed up. But it doesn't seem like she was in that state of mind. All right.
To that, okay? 3. I need to take a moment.
Yeah, take a moment, Kendra.
Moment taken.
In through the nose, out through the mouth.
It is so incredibly disturbing to me. The amount of people that are predator protectors in my comments, that are victim blaming me, especially the mental health practitioners in my comments using therapy.
Oh, I wish the comments were not turned off so I could see what people were saying. Oh man, I came late to this game.
Speak to say that this situation that I was in was my fault or that I was delusional.
I'm not necessarily saying it's Kendra's fault when I'm watching this, but I do feel like there is a level of delusion here. That's just my feeling. And I'm saying that as someone, I've spiraled where I thought people felt a certain way about me and they didn't. And not like Kendra's, what she's sharing, but just in general, like, when I've been in certain mental states. Yeah, I don't know if Kendra's going through a spiral, like right now in this video. She might be.
Check yourself. You're giving me more ammunition.
No, but Kendra, you came up here on TikTok and decided to make I don't know how many parts are to these videos to tell your story. And again, I could have not been hearing certain things. Maybe I missed something. Maybe I wasn't hearing it properly because I was diagnosed with ADHD back in the day and other things where maybe I'm not taking in the information as it's coming. And I recognize that, but it doesn't seem like you do. So it's
share my story because
no one made you share your story, though. Like, this is something you came up your own free will, and it's seeming like you're doing it to go viral, to get viral, and or get the attention of this psychiatrist specifically. Because after you mentioned he commented about turquoise glasses, I've seen you wear these glasses now in every video.
To show how absolutely messed up the mental health industry is and how protected people who do this kind of sick psychological manipulation.
I will say I do have, as an individual, because of my own experiences, pretty strong opinions and feelings about like psychiatry, the mental health, like the whole thing. And I do feel like psychiatrists and therapists and all of this, they're people, meaning there's good ones and there's bad ones. I feel that way about doctors as well. If you've had good experiences, personally, not Kendra, not you, Kendra, but if someone's watching this, like if you've had good experiences with doctors, psychiatrists, therapists, I think that's great. I've had really bad experiences. As a matter of fact, out of all of the therapists I saw, there's only two that stand out in my memory as therapists actually three that were good. They tried, to help me, I feel, and were professional and just seemed to come off as actual good people, separate from being a therapist, just, because these are human beings, okay? Like, if you have experience in life, some people are shitty, some are genuine. It's just what it is. Just because you're a psychiatrist or a therapist doesn't put you above. Although I will say that it is an issue in the medical field in general that I've experienced this more so with doctors, like in medicine, not so much the psychiatrist and the therapist, where they have like a God complex or something. Because it's almost sounding like this is how she's describing the psychiatrist. Like he has he's holier than thou, better than, and was manipulating her the entire time sort of energy going on.
So I will continue with my story tomorrow. I will see you all then.
Oh.
I need to address three things.
Well, she was real sassy and smug in that video.
Welcome back to another installment of I Was in Love with My Psychiatrist and He Kept Me Anyway, Part 8. You all did some nasty work last night, and I had to turn off comments.
I guess this is where, like, things took a turn. Where Kendra, did you think you were going to share this and everyone was going to fully support you? Maybe she shared this actually, like, in her mind, this happened, this is her truth, and she was sharing it, and she thought she was going to maybe connect with, lots of people who maybe experienced the same thing, or were going to just agree with her. Kendra, I don't know if you're new to the internet. Sometimes people, they'll say things in comments just to try to get under your skin, whether they agree with you or not. You know what I'm saying? So, that's just, take it with a grain of salt.
People started posting my psychiatrist's first and last name, his picture in the comments.
Oh, interesting.
That was a jump scare.
So he was literally doxxed. How did they get that from just his first name?
So, yeah.
This is just something I just felt, and I could be totally wrong. But I wonder if she, like, put this story up and then under a sock account doxed him. Because, like, she's so pissed about all of this and wanted this man to be doxed. That's just something I just felt. I could be totally wrong. But that's kind of weird. How did he get doxed? In that video we saw before, and she said, didn't she say she accidentally said his first name? Okay, I don't know. A few bad actors who wanted to be super sleuths got the privilege of commenting, mostly hate, let's be real, taken away for everyone. She really, though, you do come off smug as fuck. So at this point in the story, there are two main... If I was your therapist, I would find that very unattractive, Kendra. Players. My psychiatrist, who's my age, who crossed major ethical boundaries,
and my therapist, who is a 75-year-old woman with a PhD. Neither of these people at this point in the story I knew were crossing boundaries. I thought that everything was hunky-dory and that I was just in love with my psychiatrist and it was totally normal. Little did I know he was manufacturing everything so I could fall in love with him, because it was on him to set the professional boundary and not let attention build. So
again, I just need to know, Kendra, did you actually express to this person in words what you were feeling about him specifically? Because I don't feel like she really said that.
Days after my psychiatrist's Christmas morning appointment.
If she actually said that and then he was like, oh, it's totally normal and and didn't suggest for her to go somewhere else, then yeah, that is unprofessional, unethical.
From a few videos back where he got a crush confession from me and then 30 minutes of non-stop intimate content that he did not stop me. My boyfriend and I broke up days later. So then I started dating this other guy. And this other guy, this new guy, was a therapist. And I was like,
what?
Oh, great. Someone who will be able to emotionally meet my needs.
You know what it sounds like? It almost sounds like this person has a fetish for therapists in general.
Yeah, I'm not going to date another therapist again.
So wait, first of all, you're an adult person. No one forced you to go and date a therapist. Like, I'm confused by you, Kendra.
So this therapist and I, we went for
I mean, I do feel you need a therapist. Not to be a dick. I need one too, Kendra. I need one too. For different reasons.
Coffee. It was nice. Our second date was a hike. And on this hike, this therapist starts telling me about how he has a crush on one of his clients.
Stop. So now you're dating someone, they're a therapist. You're like, great, they're going to be wonderful because, like, therapists are like gods. They're perfect. Which I already just said that they're human beings, all right? A lot of therapists need to see a therapist, all right? To have someone to talk to because... All right, so now you're dating a therapist, and this therapist now, while you're on a date, is telling you how they have a crush on one of their clients.
And I thought to myself,
and you thought, I'm not your therapist. Why are you telling me this?
This is strange, but go ahead. Like,
go ahead, tell me. I can't wait to tell my TikTok audience.
On a date, dude. Why are you telling me about a crush on one of your...
Oh, I don't know. Maybe because he's just an idiot man who happens to be a therapist.
Clients, but go off, King. So
man, whoever that guy was, if he's real at all, because I honestly don't know if I believe anything this person is saying. But if that's true, man, he's gonna really regret telling her anything.
Then he was saying, yeah, she's so attractive, and I think she likes me too. I go and visit her at work, and her coworkers say, oh, so-and-so talks about you all the time.
I don't believe this at all. I don't believe anything you're saying, Kendra. I want receipts. You're telling me that you started dating a guy, he happened to be a therapist. While you're on your second date, you're hiking, he tells you, I have a crush on one of my clients, one of my patients. And you're like, oh my God, that's gross, but tell me more. And then he's telling you, I go and visit her at her job. That doesn't even make sense. All right, now I'm going to start sounding all smug like you did in that last video, Kendra. What you're saying literally makes no sense. It's a good thing you turned the comments off, because...
And I was like, okay, where does she work? And he said, well, I shouldn't tell you that, because I really shouldn't be visiting her anyway. I was like, okay, no problem.
I've never heard of such a thing.
So then he continued.
I have never heard of such a thing in my life. What are you talking about?
And he said, yeah.
If you had a therapist and they visited you at your job or something, please let me know in the comments, because I've never heard of such a thing ever.
Wears these red lacy panties and short skirts. And I know she wears them for me. And like alarm bells were going off in my head. Mind you, I had no idea that my
This is the weirdest. All right, go ahead, Kendra.
psychiatrist had similar feelings towards me at this point. But I just thought, wow, this man is borderline predatory. And he said, yeah, and you know, she just is so attractive that I have to smash her mate before every session because I just have to get that energy out of me. And I was like,
I feel like if a therapist or psychiatrist was feeling that way about a patient and they did share those feelings, it wouldn't be with someone on a second date. It would be with their therapist or psychiatrist. All right? And I'm real talk.
okay. And yeah, he just felt compelled to tell me. And
it's almost like, I don't believe, this could be a real story, but personally, I don't believe what you're saying, Kendra. I just don't. The way you're telling the story and everything to me just doesn't make sense. I'm not buying what you're selling here, but
did not understand why. Now I do. So he told me about how he's a predator, right? Another predator in the mental health industry. Shocker. So then...
And I'm not saying there aren't people that are unethical or like what she's describing in this field. Because I dealt with one that was like that. And there was probably others that I didn't pick it up on or whatever. Because that's something I've seen when I was younger especially. But this story doesn't make sense.
At my next appointment with my psychiatrist, keep in mind, it had been 6 weeks of nonstop fun for this man. He got to use my crush confession and 30 minutes of content, for whatever he wanted to use it for, right? And if my psychiatrist was good...
I'm sure your psychiatrist was telling his girlfriend on their dates, you know, I have this patient, Kendra.
anything.
I love her tortoiseshell glasses and when she wears curls in her hair.
It was being professional and acting professional and technically not crossing any lines. And he thought that he was so good at it because he was good at it. But that doesn't mean he wasn't doing it. And so I told him, I said, yeah, Bo and I broke up. He had known about this other guy, my psychiatrist. I had mentioned him.
Are we gonna talk Bo now too?
And I told him that...
Bo, I want to know your side of the story.
This new guy and I went on a date and we went on a hike. And I literally had no idea at this point.
And then I told him that he has a patient who likes to wear red, sexy, lacy undies.
I'll say it again. That my psychiatrist was predatory towards me. I almost said his first name again. I'm going to do my best to not.
What does it matter? He was already doxxed, apparently. Not by you, though, Kendra, right? Wink, wink.
So I went to my psychiatrist and I told him this story about this man that I went on a date with who's a therapist is relieving himself before appointments and talking about his clients' panties and doing all of these other extremely inappropriate things like visiting her at work. And this man, my psychiatrist, looked like he had seen a ghost and like he was gonna vomit because he prided himself on being an extremely professional and buttoned up person. But here I was.
I don't understand. You're saying that he prided himself on being professional, but everything you've been saying in these videos is stating that he was unprofessional from the get. Make it make sense,
holding
Kendra.
A mirror to him with exactly what he was doing, but a bumbling idiot telling me like how he was doing it without the fancy degree, without any of that. I look back on that now and it's just crazy. And so it just tainted all the fantasy material that I'd given him the session before.
Oh my gosh.
Welcome back to another installment.
I'm going to end this here because I don't know how many more parts there are. But if you guys are interested, I will watch the rest of them and post them so we can see where this is actually going. Because honestly, Kendra, I don't know about you, Kendra. All right, you guys let me know your thoughts so far. Am I the dick? Maybe I'm the dick. Let me know. Let me know in the comments. And if you guys want me to put up the rest of her, her story, I don't know how much longer this goes on. Let me know. All right. If you made it to the end, thanks for watching. And I'll see you in the next one.